They're testing mice and their responses to fasting. Apparently, the healthiest portion of fasting is breaking the fast. Do you use medicine or surgery to cure blindness?
Actually, I'd say both, because blindness is a very vague term.
Some of the highest burnout rates, ER is at 56.5%, internal medicine 51.4%, OB-GYN 51.2%, family medicine 51%.
I apparently encountered a pool of sea urchins. I stepped on one and almost went into anaphylaxis.
Precancerous polyps are more likely to happen with the fasting. You have this stem cell activation turn into whatever, and one of those things they can turn into is a cancer. All right, welcome to the Doctor's Life podcast. We're the Torabi brothers discussing everything between medicine, lifestyle, and whatever comes in between. Dr. Rod, Ruz, Ram, let's go.
So first we're going to start out with just talking about Ram, trying not to make fun of him and let him talk us through his path to where he's at now.
Before he starts, he's the newest Torabi, part of Elite Plastic Surgery, just finished training. Just moved back to the greater Phoenix, Scottsdale area.
We'll ask him what he does too, because we still don't know.
What do you do? What do you do?
Yeah, so I'm Dr. Ram. So basically my route to where I'm at now, which is I'm an oculoplastic surgeon, which no one has any clue what that even means.
I still don't.
Yeah, most physicians have no clue what I'm talking about. But a very long route to get to the point I'm at now. A lot of struggles, but ended up being where I want to be and loving what I do now. We all grew up in Rhode Island. I was the youngest of the four boys.
So are you a physics teacher? That shirt looks like it.
This represents my love for eyes.
Those are eyeglasses, in case someone's just listening. It's got a button-down shirt made for like a 65 to 75-year-old on a Hawaiian trip covered with eyeglasses.
I bought it before residency, and this is the first time I'm wearing it. I thought tonight was a good night.
Are you serious?
Swear to God.
Is it the Warby Parker? Is it the
I don't know
Warby
why
Parker
it was in
uniform?
it was in my closet, and I was just like, you know what? I haven't worn this, and it probably should be at Salvation Army, but tonight's the night.
I got a couple questions. Did you get it before or after you matched into ophthalmology residency?
After.
Was Nez asleep when he walked out of the house?
Definitely.
Nez actually agreed on buying this shirt.
Okay. All right. Last question about the shirt before we move to serious topics. Over under 30 minutes you spent on the TJ Maxx clearance rack to find that shirt.
I think it was actually Nordstrom rack.
Okay. All right.
I want a step above. You think I'm going to go in with my wife to TJ Maxx? That's a personal decision.
Yeah, you
I
might
would
as well
make.
douse yourself on fire. Like douse yourself in gasoline and set yourself on fire. All right, now pass the shirt. Okay, you got the shirt. You started before residency. Where were you at?
Yep. So, as you can see, my brothers are very jealous of who I am and what I've become because of my great shirt. But
you were a chemistry teacher, though.
I was a chemistry teacher.
Yeah,
You were a high school chemistry.
I forgot about all that. Yep. So as y'all know, we grew up in Rhode Island. I was the youngest of the four guys. And I went to Providence College for undergrad, got my chemistry degree there. And then first year out, knowing these guys were already going to be physicians, I had a lot of time to really reevaluate if I wanted to do it or not, and they never pushed. They always just gave me the straight up facts about what it is to become a doctor and how, like, their struggles and their rewards from becoming a doctor as well. And we're like, you just need to really dig down, and if that's what you want to do it. But if it's something else, do that. It was like, why don't you just go into business and take care of all our money, which was probably a great idea at the time for sure. But at the same time, that first year I ended up teaching high school chemistry, was waiting tables. And I just felt like that's what I wanted to do. I really wanted to help people. And I was ready to make the sacrifice I needed to become a physician. To get into ophthalmology, it took me down a whole different route. But after that, deciding I wanted to go into medicine, my undergraduate GPA wasn't the best, so I decided to do a post-bac program at UPenn. I did pretty good there, did some research at the UPenn ophthalmology office, and then applied for the first time to U.S. medical school. Didn't really have my ducks in a row as well as I should have at that time. Didn't get in. Went and got a master's degree at Boston University in medical sciences. Also did research at Mass General at the time in transplantation for 2 years. Completed a thesis there. Applied to medical school again after 2 years there, and got waitlisted at 5 schools at the time and did not get off the wait list. One school even told me that I'd be the next person off the wait list, as the chairperson who I worked for called the school directly. So I didn't get in. Went to the Caribbean, went to American University of Caribbean for 2.5 years. And through that time period, after that, I did really well on my step 1, which is our boards for medicine. It's the first step, basically. I did really well on that. And one of the factors that was holding me back was my MCAT scores from undergrad, which a lot of places correlate with your step 1 scores. But I think I was second in my class at that time. I did really well on the boards, and then I was able to transfer into U.S. Med School at that time. I went to Eastern Virginia Medical School. And at that time, I think there's only like 3 or 4 spots that they allow for transfers from other schools, and I was able to get in.
That's at Eastern Virginia, or is 3 or 4 spots?
No, 3 or 4 spots through the whole country.
So out of every med school in the U.S., there's only like 3 to 4 spots. So it's not like realistic for most people to think, well, I'll go to the Caribbean and transfer out, just so it's not like just misleading to some people.
Yeah.
With like what it takes to like get to where you're at.
Yeah, it was very difficult. And obviously everything I did before going to the Caribbean allowed me to get that transfer position, but it was just a couple of things that they saw, like my step 1 score, that allowed me to really, they basically saw my application, and I was able.
But it's not just the step 1 score. Like you have significant research experience. You're at one of the top eye institutes doing research before med school. So it's not like just, it's the whole package, because people still contact me like, oh, how'd you get this? How'd you do that? It's like, it's not one thing. You got to like put the whole package together.
Yeah, it's very holistic for sure.
And sell your story as well.
Yeah, and speaking on that, when I went in for my interview at Eastern Virginia, I sat with basically 6 or 7 people in one room for an hour and a half or so, and they were just rallying off questions, but it was very easy for me because I had all these experiences. So any question they threw my way, I could easily be like, well, I did this or that, and that's why it's made me who I am, and this is why I want to go into what I'm going into.
When it fits, the interview goes really well. You're just like, all right, I got this.
Yeah.
You start off a little bit nervous, and then like, it's like, I'm just going to tell them exactly how it is, and they'll gobble it up.
Yeah, sort of like my first podcast.
Yeah, exactly. So are you more comfortable now?
Yeah.
Ready to take that shirt off? So then,
but yeah, like at the end of the interview, I remember asking the guy, I was like, so when are you guys gonna let me know whether I'm in or not? Like the dean of admissions, and he just started chuckling. He's like, I think in a couple minutes. And he just started laughing. I was like, okay, this is awesome.
That must have felt good.
It felt great after getting denied so many times, and keep battling. And honestly, that wasn't even my goal. I just wanted to really be the best I could be while I was at the Caribbean.
Get a pocket protector for your shirt.
Yeah, you don't want to mess that one up.
But it got me to that point. I didn't even think I would get there, and that wasn't a goal, but I just was like, well, my application shows it now, so why not give it a shot? And
so that's what, 2-3 years of post-bac, master's, research before med school?
5 years before med school.
5 years before med school. That's not counting undergrad.
Yep. After undergrad, 5 years.
5 years in med school?
5 years in med school because of the transfer. Yep.
So that's 10 years.
Yep. And then
you start training what you're going in for.
Yep. And then I started ophthalmology.
You got the shirt and you started ophthalmology. That's perfect. So 10 years in, you start ophtho.
Yep.
And
what made you choose ophtho, or when did you know you wanted to do ophtho?
I learned about ophthalmology when I was at UPenn, and that was probably like 2012. Right after my post-bac, I was doing research there. And that's when I was like, oh, this is a really cool field. Really get to fine tune, like you're seeing every single detail on examination to be able to see and diagnose and then treat right on the spot, I think is a really cool thing. And having the ability to use medicine and surgery at the same time, it's just a really good field to get into.
Do you use medicine or surgery to cure blindness?
I'd say both, because blindness is a very vague term. So honestly,
true. It's a spectrum.
Very vague term.
It's a spectrum, yeah. Because if it's from cataracts, you switch out the lenses.
Yep, cataract surgery all day. But if someone comes in with acute angle closure glaucoma, they'll probably come in and they could be like light perception, and you give them medical management, and you don't have to do anything surgically. Sometimes you have to do laser therapy.
Nice.
So it all depends.
Give them peptides.
And then that was at University of Arizona. And then I did oculoplastics training at Duke. I'll try to explain oculoplastics. I mean, a bread and butter oculoplastic surgery is definitely dermatochalasis, which is you do blepharoplasty, and ptosis surgery, which is eyelids drooping.
What's blepharoplasty?
Blepharoplasty is when you have excess skin on your eyelids, and
dermatoclasia is the excess skin.
Is surgery for the excess skin. Sorry. Yep. It's surgery for the excess skin on your eyelids.
Come on, you got eyeglasses on your shirt. Let's go.
And then we suture it up at the end of that. And, some people do it for cosmetic reasons. Other people, functionally, it affects the superior half of their visual field. And there's a lot of good outcomes.
Break that down for plain terms.
Breaking that down.
Just plain terms. Yeah. Your eyelid's not functioning, so it's blocking off some of your eyesight.
There's excess skin over the top of your eyelid that's drooping over the top portion of your eyelid, so you can't see. You don't even realize that you can't see the top half of. You'll see some of the top half, but there will be blockage of a number of degrees of the top half of your visual field.
Again, a spectrum. Some people have a little bit of ptosis or drooping where it only covers a tiny bit. Other people, you're just like, wow, how have you been functioning? Like you're practically blind in one eye just because you can't lift your eyelid over to uncover a good amount of your eyeball.
Yeah, absolutely.
And there's multiple surgeries matters how severe, right? And different grading and what type of treatment you're going to come up with for that.
Mm-hmm. Yeah.
So that's generally ptosis repair or drooping lid repair.
Yep.
So you did 20 years of training to
just for that.
Upper eyelid? What?
Well, we also take care of eyelid malpositions, which is say your eyelid's turned in or turned out. We can do surgeries for that. We also do tear duct surgeries if you have a tear duct blockage.
Tear duct's a pain.
Yeah.
That's just I've done a couple cases like with the trauma, and it's
done too many.
It's brutal.
What, the canalicular lacerations? Or
yeah.
I mean, I do canalicular lacerations all the time. And like, I mean, that's what they're calling this for the most part. We're either repairing an eyelid for trauma cases for dog bites, which we see a ton of.
Car accidents.
Yep, car accidents.
Do you do any muscle or bone work?
In what way?
Anyway.
Like orbital floor fractures.
Yeah, we do orbital floor fractures. We do muscle, say, like we also do Mohs reconstruction, where we'll do flaps, which is like advancement of skin or skin grafts from elsewhere to recreate cheeks, eyelids, back portion of eyelids, front portion of eyelids. It's very difficult to, say after a cancer, make sure the eyelid's in appropriate position. I feel like without an oculoplastic surgeon, if it's involving the eyelid, because a common thing we see is eyelid retraction after if someone isn't trained to recreate the eyelid.
Certain eyelid resections you can just close primarily, but even that primary closure is going to set the positioning of the eyelid off.
Yep, absolutely.
Yeah. So Mohs reconstruction, and it's talking about is after like cancer, like getting a cancer of the eyelid removed. That's going to leave a certain amount of defect, and it's hard to tell until that Mohs surgeon's done with their procedure. Yep. So you have your treatment plan, and you kind of guide it for each defect, like which layer of the eyelid's involved and how much, like what percentage, right?
Yes, exactly.
The muscle work I was asking about is more like periorbital muscles, stuff like that. Is there any options for stuff like that? Because that's like out of my realm.
Periorbital, like
muscle tightening or
myectomies. Like we do, like say for blepharoplasty, we try, some people will remove some muscle when we do our blepharoplasties. Other people don't like removing any muscle because they want to make sure, there's a muscle that closes the eye and there's also a muscle that opens the eye. So the one that closes the eye is the orbicularis oculi. And that muscle, most people try to stay away from taking too much of it because they want to ensure that there's adequate closure. So a lot of times no, but a specific reason we would remove muscle is for patients that have blepharospasm, where they have a lot of eyelid twitching in both eyes.
Do you ever see in blepharoplasties where you're removing the skin but have excess like bulge or something from the muscle mass and just resect a little bit of muscle?
Yeah.
On that way.
Yeah. I almost always resect a little bit of muscle.
I think a lot of people do.
Yeah.
A lot of people do. And
Suture
a lot of
the
people.
Muscle?
No, I don't.
Yeah. Okay, good.
I feel like half of the people will resect a good amount of muscle and half the people will stay mainly skin. But if there's fullness to the eyelid, regardless of who I've seen, they will always take a little bit of muscle.
We don't want to get too technical.
Yeah, sorry.
Yeah.
So the orbicularis.
So how far do you go? Do you do boob jobs?
Facelifts?
but you guys can do like facelifts and stuff.
Yeah.
Of course, there's probably someone in the country that's doing breast augmentations and they're oculoplastics or ophthalmologists.
Yeah, that's
because
more.
There's so many.
Yeah. Maxillofacial surgeons, maxillofacial surgeons. Like I have friends that do body contouring.
Yeah,
just like okay, go for it. You're allowed to.
Yeah.
And you can say you're board certified, but it's like, which board are you certified in? So
you can confuse everyone.
Oh yeah, it's easy to pull the wool over someone's eyes.
But like, how far did you guys go? Because I see a lot of oculoplastics guys. They're not ophthalmologists, but ophthalmologists that were oculoplastics trained. They're doing facelifts, mid facelifts. I know you said you guys didn't do too much like in the realm of facelifts themselves, but like the mid face stuff, you guys still did, and then brow lifts you do.
Yeah,
should be doing.
Do you do endo brows or what do you?
We mainly did direct brows, but we did also do some pretrichials as well. Okay. I've seen endo brows, but I've never done them myself.
Yeah.
But the pretrichials had a lot of good results.
Yeah.
From what I saw, I didn't personally do any of the pretrichials.
Yeah.
What's the difference?
Pretrichial, basically there would be
just in the
W, into the hairline. and it keeps the forehead so you don't increase the forehead length, because if you do a coronal, you will increase the forehead length when you do.
That's because you're putting the skin on extra stretch.
Yeah,
for the forehead.
And then I mean, direct's just direct.
Yeah,
and that's more of a
to the
that's
bone.
why.
I do that in men.
We just close. Yeah, it looks good in men, but still, even that, we just do a small temporal because of the scarring there. You know, it always leaves a little bit of a scar, so we always let everyone know there's going to be scarring, but it does give good results, and we try to stay away from the midline when we do the brow.
Can you do it on one side so you can do like the Rock? I still can't do it.
When people do have unilateral, we do for sure. But
did I get it? No, I can't get it. Covered eyelids.
Yeah.
We do orbital tumors as well. Like we'll resect a cavernous hemangioma in the orbit, or biopsy and lacrimal gland tumors. Because
it's pretty fine work.
Yeah,
we're used to the microscope, but that's still pretty fine work.
Yeah, everything's close to the optic nerve. So I mean, there's a lot of cases we have combined cases with neurosurgery and ENT where we have skull-based teams.
Yeah, skull bases. You have to cover those bases. So today we covered oculoplastics and the new Torabi here. So that kind of gives you like a good feel of if you're out there, you're interested in becoming an oculoplastic surgeon, what the steps might be. It might not be as long. It might be longer route, but it's not easy to do. There's a long path. Either way, even if you go straight from med school, then it's ophthalmology training and then oculoplastics residency. So even that route, like
ophthalmology is always one of the hardest to get into.
Yeah, hardest specialties to get into regularly, like in the top 5. So that's still, if you're able to, let's say 4 years of med school, 5 years of ophtho, 2 years of fellowship, and that's 11 years if you just go straight through.
4 years of ophtho.
4 years. Oh God,
it's prelim. So highly you do a prelim year and then 3 years of ophthalmology.
Okay,
but
that's not bad.
Yeah, I mean most people.
How long did the consults take you when you get consulted in trauma for like just a clearance as a resident? As a resident, when you're like a first or second year resident, you're called in at like 3 a.m. because a plastic surgeon's like, I need opto clearance before I fix this guy's orbital floor. How long did that?
I mean, it would take 40, 45 minutes.
That's a decent amount of time.
Because the thing is, I mean, you're basically doing all the eye vitals, which is quick, but then you got to dilate them. So you got to wait to dilate.
You guys come in with a suitcase?
Yep.
Kind of look
we
like
got a little
Mr.
briefcase.
Magoo coming into the ER. Like, finally they're here. We can roll into fix the orbital floor in like an hour now.
My stewardess is here.
I had one resident. She was notorious at I was just like, oh my God. I had to like second guess how much I wanted to fix this person's eye. So I'm like, I have to talk to her and like explain to her why she went into the residency she went into and that this is her job to do this. It's just like, is this worthwhile? Like, how bad is this guy's eye? Let me look at the CT scan again. Okay. Yeah, he needs it. So
sadly the case for some of us, I guess.
It's in every specialty, dude. It's like, just like, come on. Like, you signed up for this. Yeah. Like, I'm here. It's 3 a.m.
I'm calling you because I need your help.
Like, if I didn't need you, trust me, I did not do this specifically to pull you out of bed to come here with your.
Or when the guy had a bullet in the middle of his orbit and like the guy's like, I don't know, can you go and do a visual field test? I'm like, dude, I have nothing to do with it. Like, what you want me to do? He can't freaking see out of his eye. He's got bullet in the middle of his eye. You need to come and see him. I'm like, I'm not even, I wasn't attending at the time. I'm like, I'm not your resident, buddy.
I had one guy come in.
Was it a globe rupture or did it go into the orbit?
It was into the orbit.
Like, yeah, I mean, you got to, obviously, and it was a resident that you were calling? Do you remember?
No, it was the guy that you actually like rotated with.
That's funny.
I had a guy that came in with
makes
like
sense.
the bike pedal sticking in his eye like this, and they asked me to say, "Well, what's his visual acuity?" I'm like, "Nothing."
Yeah, he
but
can't see.
there's a bike pedal sticking in front of his eyeball. Looks like it's going in there. Somehow, the pedal like just pushed his eyeball to the side while it went right into like his cribriform plate and stuff onto the other side. Removed it, and he had no deficits.
That's crazy.
It was like if I showed you the pictures, you'd be like, yeah, he definitely lost that eyeball.
But there is also a route through plastic surgery into oculoplastics. For us, I think the fellowship's only like 6 months, but I don't think we get as intricate as you guys with it. But we do, like I did 1 or 2 months. Like we do 1 or 2 month rotation in oculoplastics.
Is it more just strictly cosmetic?
No, it was actually like it was a lot of ectropion and entropion repairs, like
really?
taking the palate.
We didn't cover that. It's the
Yeah.
ectropion and entropion.
nice.
Stuff.
Yeah, you did. He said
Yeah,
it. Yeah,
eyelid malposition.
yeah,
Yeah.
I simplified it.
yeah. But
Yeah, I mean, we rotated. We'd have plastics. The plastics residents would come with us at least a month a year, every year, I think.
every
We
once
did.
in a while.
We didn't do ophthalmology.
We didn't rotate with them. They rotated
Yeah,
with us.
We did my program at the time. They changed it since then. We did 2 months of ER, and I was just like, I got a newfound respect for these ER docs. That filter from like a person entering the door to you seeing them, it's just like, oh my God, like what do you go through? That's still why ER is always one of the top 5 in burnout rates.
It's not an easy job.
No, not at
definitely
all.
it's not.
And then
But they're having a lot of open spots now in the match.
they're going
really?
to
Yeah.
a lot of things.
Because
like-
people don't.
It used to be lifestyle, but now, after COVID, I think it changed.
It's
I
tough
forget,
with the
someone said
shift
why,
work.
but-
Those 2 months were like the only times in like residency where I was actually watching the clock. Like, when is my shift going to end? When can I go home? Like, this guy's like just spitting at me and calling me racial slurs, and it's the wrong race. Like, like this is kind of crazy. And just like, when's it going to end? Like 1 hour, 35 minutes, 27 minutes, 20 minutes.
But it used to be, like you do the 13, 14 shifts a month and you're done.
good.
But
Yeah.
Those are brutal, like, 10, 12-hour days.
Yeah, it's usually like 12-hour days. I think they're down.
You're
They
going
lowered
nonstop.
most places to like 8 hours.
Yeah.
That's still a lot.
Yeah.
Doesn't matter how many patients you see. It's like those 8-hour shifts are pretty brutal. But they're so the recent paper said burnout has finally dropped below 50% for physicians.
50%.
50%. But
That's
let's
crazy.
see some of the highest burnout rates. The top 6: ER, family medicine, internal medicine, OB-GYN. What else was there?
Not plastic surgeons.
No, there was no surgical practices.
Interesting.
That was none of the surgical practices were in the top 6 for burnout.
Really? I would think Gen Surge would be.
As things get taken over, like family practice, internal medicine, a lot of that's like becoming like timed visits, and you have to, getting taken over by hospitals and private equity.
Yeah,
You have to see certain amount of patients.
that makes
Every
it like
sh-
productivity
Yeah.
and making sure you have everything documented, orders put in. So yeah, ER is at 56.5%, internal medicine 51.4%, OB-GYN 51.2%, family medicine 51%, pediatrics 46.9%, and hospital medicine's 44%.
Yeah, the peds are getting crushed.
Yeah. Yeah, peds gets
Just
crushed
looking
and they get paid the least too.
Yeah,
They get destroyed. I mean,
Yeah.
it's one of the toughest jobs, I think,
yeah.
is you're taking care of kids and then you're
Taking care
dealing
of
with
the
parents too.
Taking
Yeah.
care of the parents too.
Yeah. And
It's
I
tough.
mean, it's obviously one of the most rewarding because you're helping kids, get better in certain conditions, but it's still.
But just, I was talking to Pam, who's my wife. She's an anesthesiologist, and like she covers call on anesthesia, and she was just talking about it. Like some of the devastating injuries she sees on trauma and stuff, and at some young patients and stuff, and like how to prevent depression and burnout when you're seeing this crazy stuff happen to these people, and you don't just like walk by it cold, it's like it affects you every day, and like you
it's not just the physicians, like we were talking in the OR, a scrub tech.
Yeah.
It's like, I can't believe the first time I saw this, like it affected me for weeks, and like I couldn't stop thinking about it. Circulating nurse, it's that whole care team. I don't think it's given enough credit for like that kind of exposure.
For me, like I think, and my response to my wife was like, you got to take time to meditate every day. And also the other thing is you got to make sure your sleep is on point. You got to get to bed at 9, 10 o'clock at night. So you clean out all that damaged visualization and damaged like sensory effects that you have by getting that deep, good sleep, to forget about what, you're not going to completely forget, but kind of get to another place where you're not thinking about it as much. If you don't get enough sleep and you don't meditate daily, or like it only takes 3-4 minutes of breathing to kind of get your cortisol levels down. You watch YouTube and you can learn plenty of breathing techniques to kind of get you relaxed and get you, and it doesn't need to be sleep. You could be driving and just get relaxed and just free your mind a bit and just counting, like breathing in and out, will make you forget about the rest of the world and kind of relax you, which could help with burnout. I think like sleep and meditation are going to be like the biggest thing with behavioral stuff. And, these physicians, we've been always thought about helping, and you're always trying to help everyone else, but you got to think about helping yourself, and that you got to be the most important person to yourself. But you get in this whirlwind, you're in depression, and you kind of like, you don't want to do anything, but you got to, if you have the right support system and they kick you in the butt and tell you, but you got to listen to them, like meditate, get your sleep, and like, I don't know, like since I've stopped taking Tramadol, I've been way about my sleep, and my diet and my sleep are like my two biggest things. And coming from the background we come from, it's like, it's kind of hard because like you go to people's houses and they think you're being rude by not eating their food, but like, I want to know where that meat's coming from, and you better not cook that shit in vegetable oil. I'm not going to eat that
seed
stuff.
Seed oils.
I don't want to feel like crap for the next week. Yep. I do all this stuff to bring good natural products and supplementation into my system, and all of a sudden I'm like eating this that's going to make me feel like crap. And what I said was like,
RSVP to my party where I will
I hope none of the people watch this or understand what I'm talking about. I hope people don't understand what I'm or like people that watch this aren't the ones that were at the party the other night. But like, like I texted my wife because my dog got really sick from a party we went to the other night, and she ate, like, we forgot her food, so we gave her some rice, and I guess she ate some lamb and some chicken that was made that was at the party. Gladly, I had my food at home. I chomped on it before I started driving, so I didn't have to, like, they kept on asking me, when are you going to eat? And I'm like, I'll eat in a little bit. I'm feeding the kids. Leave me alone. And then my dog is sick as shit like the next few days. And I'm like, I know the dog is small and the digestive system's not like ours, but if it's doing that much damage, and it's like 3-4 days ago, and she's like pooping blood, and we took her to the vet today.
By the way, by
fine.
No means do we condone animal testing, even if it comes to your food.
But like, that's what I'm saying is like, if the dog is getting sick from that food, just imagine what it's doing to your intestinal tract. You have a stronger immune system than that little dog, so it probably didn't affect you that much. But back in the day when animal testing was the thing, their food wouldn't be able to be on the table, right? That's what I told my wife. I'm like, they used to do animal testing for a reason. So like if the dog's getting sick from this food, it shouldn't be on the table. So, like
another thing, when it comes to food in public, there's a wide usage of laxatives in cafeterias, fast food restaurants and stuff, because they want this stuff to go through you really fast, because the faster it goes through you, the less of a chance that these bugs are going to grow in your intestinal tracts. So it's made to like just burn and turn. Like if you wonder why you got to rush to the bathroom at PF Chang's, or why they have more stalls at PF Chang's than they have tables for people to sit down and eat, that's why they get you running. So hopefully it goes through your system so fast it doesn't colonize your colon. I didn't know this, and like one of our wrestling teammates in undergrad, he worked at the cafeteria, and we'd see him like just very naive guys like, hey, what are you doing? He's like, oh, I got to take these jugs to the back of the cafeteria. Like, what is that? He's got like 2 5-gallon jugs. He's like, oh, it's laxatives. And we're like, what? He's like, oh yeah, laxatives. You put it in everything. And we're like, what are you? What? It's just like, oh yes, cafeteria food. You have to have laxatives. If you don't, you're gonna get sick. And I'm like, what the hell? Right there, it's just like, oh my God, this is. He was like, yeah, every restaurant does it. You can go look it up. I looked it up. I was just like, oh my God, this is just like,
that's hilarious.
This is crazy.
So what's going to happen if you're on Ozempic that slows down your system and you're eating cafeteria food?
So you're prone to get diarrhea, not from the laxatives, but because your colon's getting colonized by worse bugs. Cholera's back, baby. Yeah. It's like the number one killer back in 1920 is going to start taking people out. Oh, what was the reason you died? Oh, I just fucking shit myself to death. No, seriously. It's like, oh, God. So, segue.
Well, we went from
burnout, shitting yourself to death. One thing I know about seed oils is if you do cook with them, a lot of them reach a higher temperature. At a similar cooking temperature. Yeah. So that temperature increase is what you want to like really avoid. Yeah. That's part of the downside, because something like, I think it's like baking or cooking in the oven over 420 degrees increases the amount of carcinogens in your food significantly. Yeah. So we used to cook with like grapeseed oil.
Grapeseed oil is like one of the worst.
Yeah, I know. It made some great chicken. I swear, 420 grapeseed oil, like it gave you the crispiest finish and juiciest tender for like 40 minutes. So if you don't care about cancer and stuff,
but like sesame seed oil, I thought you could still cook at high temperature.
I don't know. I wouldn't cook anything over 415.
Yeah, like, I don't anyways, but I thought sesame oil was fine.
Yeah, it's like, Roos, make dinner. I don't want to give anybody no cancer. Yeah. I'm not cooking tonight. But yeah, it supposedly reaches a higher temperature, and that causes that food to have increased carcinogens.
So what are the different seed oils that, like grapeseed comes to mind the most, and I think that's one of the worst out of anything. Just like you shouldn't cook on a high temperature with olive oil.
I just use olive oil.
No, olive oil, you're not... I use mainly avocado oil when I'm cooking. Olive oil goes on my salads and stuff.
What do you rub yourself with?
Niacinamide.
Especially out here in Arizona, you don't want to get that grapeseed oil on your skin. Yeah. It will burn like a hole through your whole arm. Yeah. So have you read anything about specific ingredients in the seed oils?
I've listened to a lot of stuff about it.
What have you heard?
I just stay away from them. And I'm like, all right, olive oil I can't cook with. Avocado oil was fine. Sesame seed oil was fine. Those are mainly 2 oils I'll cook with. But like I sous vide a lot of things, so I can still use my olive oil in that. So because olive oil has much better taste than I don't know. I have so like when you go to the like AJ's and stuff, you have so many choices, and some of the stuff just tastes incredible, and to add that flavor to foods. But I don't cook at high temperatures with it. I sous vide with it, so it still keeps the flavor, and use it for salad dressings and stuff. The other thing, cook with just butter or ghee over, I'd rather cook with butter because it adds much more flavor than...
Specific butter from grass-fed cows?
Grass-fed cows, German, grass-fed, engineered.
Is it German?
Butter.
Seriously?
The one I use is German, yeah.
Okay. I used to get an
I
Irish
get it
one.
from
That's the one I use,
Whole
is the
Foods.
Irish one.
Because that was the first one ready.
Whole Foods. Nelson's got a good grass-fed butter, too, that comes in jars.
So seed oils, they have very high levels of omega-6 fatty acids.
Yeah, which is the inflammatory omegas.
Chronic inflammation. And even like insulin resistance.
Yeah.
So
what are the seed oils? Do they say which seeds?
They have also been linked to increased risk of obesity, heart disease, and diabetes. Some seed oils to avoid include sunflower oil, peanut oil.
Yeah, sunflower oil is another one that's really bad.
Cottonseed oil.
Yeah.
Canola. I
Yeah.
didn't expect that one. What next? Don't eat.
What is
for
canola
some reason,
sesame
sesame seed oil's not on there. And sesame seed oil, dude, it makes like such good rice.
Does it?
Oh, really?
Oh yeah. I toss it in the boiling water and I boil the rice in that, and it tastes really good.
So stay away from seed oils. They're pretty much bad.
Well, especially to cook with.
Yeah, I didn't know until I was here. So
yeah, I was one till I just brush aside the whole chronic inflammation thing, because it's just like, okay, whatever. But it's definitely a thing, and it catches
as you
up
get
to
older, you find
I think it catches up to you, like especially in your 40s.
Yeah,
like your body, like it's just not as resilient. So like you have the symptoms, like
you feel it.
You feel it. Like unlike like 20s, 30s, you can just kind of like plow through whatever.
Yeah.
In your 40s, it's like just built up so much, and your body becomes
like
so
you go to
sensitive.
dinner and you're like, it's like 6 hours and it feels like it's still in your throat.
Yeah.
That's not how things are supposed to go.
Speaking of chronic inflammation,
yeah, I've been
how are you feeling?
I've been chronically inflamed for like 10 years, and I'm still in my 30s.
What did you get? Legionella?
Crap. I still don't
what was
know.
in that air conditioner?
I still don't know.
Was
I
it
think
the
was
air conditioner or
the
the sea
urchins?
urchins?
Yeah, I think I had this crazy response. So when I was in the Caribbean, I was in the water, and I apparently encountered a pool of sea urchins. And I stepped on one, and then I fell in the water, and it was shallow water. And then I got them in both my hands and almost went into anaphylaxis. And our other brother was there, and luckily he took me to the pharmacy and gave me a ton of meds, and I was fine. I thought I was going to pass out.
So you start getting all swollen everywhere?
Yeah, my hand was ballooning up.
The way to get the spikes out, isn't it? You use vinegar to kind of
Those spikes were, they just came out on their own. I couldn't take them out because they were so brittle, they just break. So you can't get in there and actually take them out.
No, I know, but if you use vinegar, they just like kind of
dissolve
or something. Yeah,
really?
I don't know. I tried a bunch of stuff, but
definite medical.
How about some?
I tried a bunch of stuff, but I mean, I got a bunch out, but
some nice
other stuff just worked out. They walked out.
Yeah.
They got out.
So you had a huge inflammatory response, and ever since then, what happened? You just like get congested and
I mean, I was coughing up at least two bottles, two like 20-ounce bottles of phlegm every day.
Yeah, he got kicked out of my house.
Dude, it was gross. I was
good.
Just
it was
like,
loud, not just gross. It was.
We
loud.
started to think it was conversion disorder. We're like, there's no way. He's just like 24/7 going.
This all developed after that event, and when I was in the Caribbean. So
I almost had like
I swear, Radbeh and I were like, it might be conversion.
You guys,
dude,
like this might not be real at all.
Dude, I had like phantom like thoughts of it. Even when he moved out, I used to hear it in my house. I was like, what the hell's going on?
Yeah. It's like freaking bad like hairball problem.
Yeah.
You've been licking yourself? What's going on? So what got it under control?
Well, I mean,
it's still not
It's still
great,
not.
but this is a world
still
of a
there,
difference
but at
since,
least
like,
I'm not
You're a human
Fleming
being.
like crazy.
Yeah, you're a human being.
I mean, I've been taking allergy shots for way too long, and they actually had the opposite effect on me, which doesn't make sense. Where I would actually like get a headache and feel like I'd get a headache right after the shots.
Peptides.
I get a headache right after the shots. And then the first 2 days I'd feel like crap. And then I'd get like my symptoms would get better by days 3 or 4. And then by day 7, I'd be congested again.
How are your
And I'd
poops?
be like, I have to do it again. But I stopped taking the allergy shots. Like
Oh, you did?
I spread them out to like monthly because I was like, I've been taking these for way too long. And they're clearly not doing.
How often were you taking them?
Are they
once a week?
immunoglobulins?
Oh, shit.
No, they're
immunoglobulins?
they're antigens. So they basically are giving you antigens to desensitize you at higher levels.
Yeah.
But obviously it wasn't working because I still felt like crap for a long period of time.
You're reacting to them.
Yeah.
So what are you on
But
now?
now, I mean, I'm taking Allegra. I'm taking Singulair daily. I'm doing Astapro nasal spray twice a day. And I'm doing, it's an antihistamine nasal spray. So there's no steroid in it.
Okay.
And then I'm also taking
another
spray. Yeah, it's not good.
So I don't even know what it is.
But
I huff gasoline twice a week.
At least I can talk to you guys.
Yeah.
Like,
oh, this is still
I was
way
miserable.
better. Yeah.
I was just absolutely, I mean, I'm still not.
Still laugh about it, but it was
Still
you
terrible.
sounded horrible.
Yeah, I mean, it's still battle with it. And I don't know. I'm going to try to pull myself off more Medicaid. I need to get off
Is your
the
symptoms
meds,
mostly upper respiratory? Because Ruse asked, do you have any GI symptoms?
No.
Where allergies are flaring up?
I don't
It's all
have
upper
reflux.
respiratory?
I don't have reflux, and it gets exacerbated by exercise. So I feel like when I'm exercising more, this starts coming on more. So I don't know if it's like an exercise-induced asthma or something.
I got an allergic
Something
reaction when
weird.
Sarah asked me to clean stuff. It's like, oh, God, I'm inflamed. I can't do that. This Lysol is getting to me.
I thought you were going to say you get it when someone tells you to go exercise.
Oh, that too. That too. I never thought about that.
Yeah, but I'm way better now.
So going into exercise, so I got my Carol bike.
What is the Carol bike?
So it's an AI bike that like has 8-minute workouts, and you do 2 20-second sprints, and it's supposed to improve your cardiovascular system by like 20%. And doing like an 8-minute workout on that's almost like doing a 30-minute jog outside. So it's just everything compressed, and those 20 seconds that you're going all out, it's pretty hard. So the AI just figures out and continues to increase the resistance. So with your body, so you're just getting to the target heart rate with it. And it's a pretty intelligent bike. Like it, you do a fit test, a VO2 max. They can track your VO2 max. You wear a heart rate monitor when you're on it, so it goes by all of that. I think it's better than the Peloton.
So they've had studies that show the same results then after like a certain period of
time.
Better.
It's like a re-hit. Instead of hit, you have re-hit. So with the 2 20 seconds and then recovery.
Do you think you could do the same with the Peloton?
No, because this has the AI generated resistance for that 20 seconds. You kind of can, but
it's a random 20 seconds, or
it's like you're warming up for 2 minutes, I think it was, and then 20 seconds, and then cool down for 2 minutes, and then sprint for 2 minutes again, and then, or it's like 3.
So it's just random intervals, kind of.
Yeah.
Okay.
Yeah. And you can choose, because you start out with doing 2 10-second sprints, then you move up to 2 15-second sprints. Yeah. Then after that, it unlocks it where you can choose what intervals you want to do. You could do 3 15-second intervals instead of the 2 20.
How long you been using it for?
It's been a short time. It's been I put it together and started on Sunday. So
do you feel like you're getting a workout after you're done?
Yeah, your heart rate goes all the way up.
All the way up, so you have a similar feel. Yeah.
Yeah.
Okay.
But I go after that. I go and do my like 10 minutes of resistance bands and stuff. And like Sunday, I just did yoga to kind of release my lower back and thighs, because that's been tightening up, and that's something that I need to really work on.
And something you really easily neglect, and especially being in a bike posture and doing the resistance bands.
Yeah.
It'll get you. Well, thanks for gifting us your Peloton.
Yeah.
It
was just tough getting on the
I was so happy that he finally got rid of it.
And then he got another bike.
And gets the AI bike. He just made room for the AI bike. He's like,
I was like, Rod wants it.
It's like, perfect. This works. There's just one study I saw. It's actually in Nature, and they're testing mice and their responses to fasting. Apparently, the healthiest portion of fasting is breaking the fast. I believe they were like fasting for 24 hours and seeing how their microbiomes reacted in their gut to breaking the fast. And when they broke their fast, that's actually when they had like heavy like stem cell activity, regeneration, all that stuff. But during the fast, technically, it was not that good. But because of that time in between the meals, that actually leads to better response when you do eat. But it came with some negative results, like precancerous polyps are more likely to happen with the fasting mice, and it's likely happening because you have this more stem cell activation. However, when you have stem cells, they can turn into whatever, and one of those things they can turn into is a cancer if it's not regulated well.
So, and how long were did you read into it? How long were the fasts?
I believe it's 24-hour fast.
Yeah. The thing is, like any mice study or something, it's going to be way different in timing than compared to human studies.
Definitely. And it's any of the studies, because like a lot of stuff we get taught about wound healing, repair, and like, it's this many weeks until you're 50% strength and stuff. That's based on humanized mice. And it's completely different, because I've worked with different animals, and they like evolution-wise, you're built differently, whether it's your GI or like your skin. Like if you get cut and let's say you're a wild boar running through the forest, you're going to need to heal that up much faster than like a human that can go to the ER and get it sutured up. Yeah. Because that one cut can get you killed if you don't seal that up within like 24 hours.
On the Carol bike, it actually, the first thing you pick other than music is actually
what type of
it
animal
says tiger. It says tiger. So it has this lady kind of calmly talking you through the thing, and then you're getting chased by the tiger for 20 seconds and then relaxing and then getting chased by the tiger again, whether you escape or not.
What do you think about the results since you fast? Other than this being a mice model versus human,
that's
humanized mice.
That's the main thing. No matter what, like I think you should fast, because that gives your gut a rest and your body to kind of relax and be able to do other stuff to clear itself and detox. If you're eating all the time, I don't think you get the appropriate time to detox and clear all that stuff.
Not just that, your body's using energy, because your gut uses energy. It doesn't just go through you.
Yeah, for me, process. And I have a tough time with the field we're in to, eat before, at least 4 hours before.
It's tough eating well.
Not
you
just
do a good
eating
job
well,
at it,
but like eating like 4 or 5 hours before you go to bed. So you're able to, you're already digesting and done with the digestive process almost, and you're going to bed and your body's totally shut down. And like, I think that's important, to be able to eat in a short time period so your body can get the appropriate rest and sleep and detox and everything. So I think fasting's huge. And this just goes to show you the 24-hour, and usually, different people have different ways of thinking about fasting, but more and more is coming out where this whole 12, 16-hour fast, and it's usually 16 hours to kind of get the health benefits, at least 16 hours. But like, the autophagy and stuff doesn't kick in until like you're at 3 days to 5 days of fasting to clear out the senescent dead cells. So, you
do any of the 3-day fasts?
I did a 5-day,
How long though?
the fast mimicking diet. But like I also take rapamycin weekly, which kind of acts very similar to
When's the last time you did that extended fast?
It's been 6 months. When I come back from France, I might do it again. There's a company I use Prolon that has the fasting mimicking diet. It comes in a package. You get it. It has like soups and teas and like these protein bars there. I forget who the guy is that made the diet, but it mimics pretty much being in a fast and in ketosis. The problem I have with it is like doing my supplements and everything kind of becomes hard around it. And the other thing is the soups usually have a lot of sodium and stuff. So, but some of the best sleep, you have like almost no energy. You're like, 8 o'clock at night, you fall asleep and you fall hard to the sack. You're like out the entire night, because right now it's like, I'll fall asleep with my son. It's like 9 to midnight. And then like I'll wake up multiple times because between that 9 to midnight, I get like almost 2 hours of deep sleep. Even if I get over an hour, like I'm pretty much charged, but like, you get light sleep the rest of the time or some REM in there, but it's tough to stay asleep during the night when you're like hitting it hard with the deep sleep.
Ram, what's your longest fast this last year? 2-3 hours?
Probably. Yeah, I'm not.
But he's sleeping better than us somehow.
I really need to
fast for 2 hours and sleeps 12 hours.
I sleep well when I can, but I don't sleep well anymore because I'm a child.
Yeah.
I usually fast up to like 12, 2 o'clock, and then, I stop eating at 6, 7 o'clock or try.
Yeah, I gotta be better about the nighttime thing, but I'm good with like, because just growing up, I wasn't big on breakfast, so I'll not eat breakfast, and that automatically takes me to noon, lunchtime, and then just 12 to 8. That way, it's 8 hours of eating, 16 hours not, and that's generally what I stick with.
Yeah, and once again, like we've discussed it before, fasting doesn't mean decrease caloric intake. It's completely different, because you should take the amount of calories you need whether you're fasting or not. And getting your macros and your proteins, you should take in the same amount of proteins as the day you're not fasting, because otherwise if you're caloric restricting, you're decreasing your metabolism, and you're not going to get all the benefits of being in a fast, because you're going to have decreased energy and like changes in mood and everything.
It switches into starvation.
Yeah, and you start breaking down your muscle.
So like that study just said, it's not the fast that's the health benefit. It's when you break the fast.
Do they also talk about what was used to break the fast? Because some people say, you should start off with some protein, water before. Recall. Yeah, there's different ways of breaking the fast to do it appropriately. So, you don't stimulate the bad stuff. And
gotcha.
Yeah, because, if you break your fast the wrong way too, you're going to kick yourself into this whole starvation mode and start eating nonstop.
Yep.
The article I read that was kind of interesting, it popped up today, was they had this person, it said acting like a surgeon without a medical degree in California, doing plastic surgery, and I guess one of his patients had multiple complications. He's going to possibly have to serve 10 years in prison for assault and battery. The patient didn't die, but the guy had like 20,000 followers on Instagram. And when I looked into it, the guy's he was a plastic surgeon and well-trained in Argentina, but he did not have his medical license in the U.S. So he was illegally practicing in the U.S., but the article didn't quite construe that he was a plastic surgeon back at home. Over here, he was a nurse practitioner. It says FNP and first nurse practitioner or what is it? First assist, FMP, right? Yeah.
Family nurse practitioners, FMP.
RNFA.
RNF,
registered nurse first assist. Yeah.
Yeah. If you don't have credentials to do something here, you probably shouldn't be doing that.
But like, a lot of the cosmetic surgeons, they're not credentialed. Or
and I'm sure his experience is better than him. But the way the laws work, as a cosmetic surgeon, like even though this guy's a plastic surgeon with 20 plus years of experience, he can't.
But we've had a lot of people.
That.
Yeah, we've met a lot of people throughout the year. Like I know I have like that. Like great surgeons back at home, and they come to the U.S. and they can't take their steps. A lot of them
because just going through the process. Years. I mean, if you're 45 years old and you're going to go through a surgical specialty and train like that, it's not realistic.
Yeah,
because you don't just straight up sign up, go for college classes or nighttime classes while you're working. It's like, no, it's a beyond a full-time thing.
Yeah,
and you got to struggle through it, and it's not easy to get into. Yeah. So you see a lot of people that were like, oh, I was this and that here, but now I just work in a restaurant. Like, what? It's like, I met cardiothoracic surgeons from I think it was China that was just doing your everyday maintenance job here.
Yeah, because they have to basically, one of the guys, you're basically fully trained. And then you got to come here, probably do 2-3 years of research at somewhere to be able to get a residency spot.
A lot of it comes down to the language barrier too, and being able to pass step 1, step 2, step 3. I think the language barrier becomes a huge issue, and especially as you move up the steps, because step 1's you could read the books and have the knowledge base, although it was one of the toughest because it was the broadest, but if you can memorize and get that knowledge, but then once you move to step 2 and 3, you got to be able to have the language and be able to figure out and problem solve in a different language.
And you got to be able to communicate with your patients. That's
very
an important part.
Yeah.
Yeah. But the people that can do it, it's impressive. I think one of the most brilliant people I knew was one of my ophthalmology resident seniors, and he came from Iran, but he did research for 2-3 years at UCLA. He had already been practicing for 2 years in Iran, and then they got to do residency all over again. It's this guy's already a glaucoma specialist in Iran, obviously knows everything that's going on, but now he's learning it in a different language just so he can practice here. Add another 7 years of training. And he was just brilliant and helpful. It was amazing for me because he was so helpful during residency, and was such a nice person.
It is what it is. So rules are rules kind of thing.
Yeah, absolutely.
And I think the Board of Medicine does a pretty good job with that stuff.
Yeah, I agree too. Yeah.
All right.
Rules are rules for sure.
Rules are rules.